Hey, it's Dr. Gregg with Align Wellness Center. Today we're going to talk about shoulder pain. So if you've been having shoulder pain or someone in your family has been having problems with, zip this over to them so that they can check it out. Also, if you like to receive tips and information on how to live a life of optimal health and well-being, go ahead and subscribe to our channel. So shoulder pain is caused by a lot of different issues. It can be caused by problems in the neck, it can be caused by problems at your clavicle, shoulder, or even down out into your hand and your arm. It can also be caused by problems in your lower back. We just yesterday had a patient come in, and when she came in, I had to look at her posture, and when she was complaining of shoulder and upper back pain, and when we looked at her posture, she looked like this. Now this position is not the way that our shoulder is designed to work. So her shoulder has had to compensate, and muscles that are designed to keep the shoulder stable and in the right place are now being required to use for her to move in major positions. Those stabilizers no longer could do the work that a strong mover is designed to do. For example, the deltoid muscle that comes over your shoulder is designed to help lift your shoulder up above your head. This is a big muscle, goes this wide, all the way from here up to here. Now inside of the shoulder are rotator cuff muscles. These are small muscles the size of a pencil. And what they're designed to do as a part of this motion is to pull the head of your shoulder in to allow it to go up all the way. When we wind up changing the position of the shoulder from up here on the side of my thorax and rib cage to around on the front and hanging down, we're using those smaller rotator cuff muscles to bring the arm up above our head rather than the big deltoid muscles. This causes those small muscles to weaken, fatigue, and in some cases even tear like a torn rotator cuff. And if we don't wind up correcting the postural imbalance, then we're going to be left doomed with those weakened shoulder muscles and relying on them, even if you have them surgically repaired. That's one of the reasons why shoulder surgery repairs fail very often. They may connect the rotator cuff again, but they don't wind up changing the posture to get you back in using those main movers. If you're concerned or know someone whose posture's off related to shoulder problems, let's look to connect to figure out what's going on to get to the cause of the problem so that the shoulder problem can go away forever. Once again, my name is Dr. Gregg Gerstin, and I want to thank you for letting me be a part of your health.